All right. Good afternoon, everyone, or good afternoon in Maryland. So just wanted to welcome everybody to our Children's Environmental Health Day webinar. My name is Rebecca Rear. I'm the Director of Climate Policy and Justice at the Maryland League of Conservation Voters. And at Maryland LCV, our vision is a healthy environment for everyone in Maryland. And as part of that, we are very honored to co-host the Maryland Health Professionals for a Healthy Climate with the Maryland Public Health Association. So I'm happy to turn it over to Melanie Bolden to give a quick welcome from MDPHA.
Thanks, Rebecca, and welcome everyone. So Melanie here, I'm the Climate and Health Coordinator with MDPHA and also co-convene this group with Rebecca, and very happy and excited for this event. And just a little bit of background about Maryland Public Health Association. It's a volunteer-driven organization that's dedicated to advancing health equity and improving the well-being of Marylanders. It's a state affiliate of the American Public Health Association, and its mission is to promote healthy Marylanders and healthy communities. And if anybody is interested in learning more about MDPHA and their work, I will pop in the chat their webpage. I'll pass back over to Rebecca. Thanks.
Awesome. Thank you, Melanie. And so I'm going to introduce our speakers. We have sort of a TED style version of a presentation today so that there was so much we wanted to cover for Children's Environmental Health Day as Maryland Health Professionals for a Healthy Climate, that what we decided is to have sort of 3 different TED style talks in the hour we have together, and hopefully have lots of time for questions with all of you. So I'm gonna do quick intros to each of our speakers, and then we'll dive into the presentations followed by questions. So we will first hear from Dr. Michael Ikniowski, who's the chairperson for the Environmental Health and Climate Change Committee of the Maryland chapter of the American Academy of Pediatrics. And he'll be talking about heat-related illness in children. We're then going to go to Dr. Elizabeth Reisner, who is the Director of Medical Education and a staff psychiatrist at Sheppard Pratt, and also a part-time assistant professor of psychiatry and behavioral sciences at Johns Hopkins School of Medicine, where she'll talk about pediatric health impacts of plastics in the environment. And then our third and final presentation today will be from Dr. Robert Fetter, who's on the executive committee of the Medical Society Consortium on Climate and Health, on the steering committee for the Climate Psychiatry Alliance, and the board of directors of New Hampshire Healthy Climate. And he'll be talking about the effects of climate change on children's mental health. So quite an expansive range of topics today. We hope you enjoy it, and make sure throughout the presentations you put your questions either in the chat or the Q&A, and we'll get to as many as we can before our hour together ends. So with that, I am going to turn it over to Mike to get us started on heat-related illness in children. Over to you, Mike. Thanks so much.
Good afternoon, everyone. I'll be giving the first talk today, which can be considered a warm-up talk for today's presentation. And appropriately enough, I'll be talking about heat-related illness in children and teens. Can you bring up the first slide, Rebecca?
Hey, Mike, are you seeing the slides? We're showing the one that says a warming planet with the...
Yeah, I don't see the slides on my phone.
Okay.
All right, well, go ahead and get started. The Earth has been warming at an accelerating pace for the past 40 years, with the past decade being the warmest decade on record. This graph here shows the change in average global temperature by year relative to the pre-industrial baseline, which is represented by the 0 line on the graph. The graph shows that each year, this global average temperature is moving a little further above that baseline. Next slide. 2023 was the hottest year on record, with an average global surface temperature 2.1 degrees Fahrenheit above the baseline of average temperatures from 1951 to 1980. 2024 is on track to surpass that record, as this bar graph comparing this summer to the last summer indicates. What this means is that more and more people are being exposed to extreme heat and will have an increased risk of heat-related illness, and that healthcare providers will see increasing numbers of patients affected by extreme heat. Next slide, please. Heat-related illness occurs when warming of the body exceeds its ability to cool down and dissipate the heat. Heat cramps are an early sign of heat stress. Exercise intensity and degree of training play a role in these muscle spasms, but dehydration from sweating increases the likelihood of muscle cramps. There are no mental status changes at this point, and treatment with rest, cooling, fluids, and muscle stretching will help to relieve these symptoms. With heat exhaustion, the core temperature rises and profuse sweating occurs, with the skin becoming flushed and warm. Symptoms like fatigue, headache, nausea, and vomiting may occur, along with mild mental status changes of dizziness, confusion, and syncope or near syncope. Treatment includes moving the individual to a shaded or air-conditioned location, removing the outer clothing and padding, and cooling with ice packs or cool towels, and drinking chilled oral fluids as long as the individual is alert and not vomiting. Next slide, please. Untreated, heat exhaustion can progress to heat stroke, in which the core temperature rises to 103 degrees Fahrenheit or higher, and significant mental status changes start to occur. Sweating may be profuse, but could be reduced or absent in the presence of moderate to severe fluid losses. The skin will feel hot, and the heart rate will be rapid and possibly irregular. The individual may be delirious, combative, and ataxic, and may lose consciousness. Heat stroke is a life-threatening emergency that requires immediate measures to cool the body while waiting for emergency medical services to arrive. Ice water baths are optimal, but if one is not available, ice packs and cold towels should be applied over as much of the body as possible. As in any emergency situation, maintaining the airway and monitoring breathing and circulation are critical while aggressively cooling the heat stroke patient. Next slide, please. Risk factors for heat illness are the conditions that affect the balance between heating and cooling the body. They can be external environmental factors or internal factors based on the individual's health and fitness. Environmental heat sources include the temperature, the humidity, solar radiation, which are all additive in their effects. Availability of cooler areas outdoors near the exercise site or indoors in air conditioning can mitigate the effects of environmental heat. Next slide. Individual factors are also important for risk of heat illness. Thermoregulation through sweating and cooling develops steadily with growth, being less efficient in infants and toddlers, and steadily improving through childhood into mid to late adolescence when adult thermoregulating ability is reached. Fitness improves the efficiency of exercise, generating less heat from muscular activity as conditioning improves. Acclimation to hot weather exercise improves the body ability to cool itself through efficient sweating. Being well hydrated before and during activity is necessary for adequate sweat to be produced and for replacement of fluids lost through sweating. Nutritional status is also an important risk factor. Overweight and obese individuals have layers of fat that retain heat within the body and make it harder for sweating to provide adequate cooling. We'll discuss some of the illnesses and medications in the next slides. We'll have the next slide, please. Acute illnesses with fever, vomiting, or diarrhea affect hydration and need to be resolved fully before returning to activity. Some febrile illnesses may also include muscle inflammation that can worsen with exercise and muscle use. Chronic illnesses can increase the risk of heat illness also. Excessive urination, as in poorly controlled diabetes mellitus or in diabetes insipidus, can predispose to dehydration. Cystic fibrosis can lead to abnormal sweat electrolyte losses and subsequent metabolic disorders. Hyperthyroidism with increased metabolic rate generates more heat internally. Increased sickling can occur with exercise and hot weather for patients with both sickle cell disease and sickle cell trait. And these folks may be at risk for exertional rhabdomyolysis, where the skeletal muscle starts to break down. Children with physical or developmental disabilities may have problems moving themselves to cooler environments or communicating that they are in distress. And a history of previous heat-related illness may also increase the risk of a recurrence. Next slide, please. Certain medications may increase the risk for heat illnesses, generally by one of three mechanisms: alterations in sweating, which impairs self-cooling; increased urination, which may predispose to dehydration; and increased internal heat generation through metabolic stimulation. I've listed several classes of medication for each of these groups and some examples of each. For medications that affect sweating include anticholinergics like atropine, antihistamines like cyproheptadine, phenothiazines like chlorpromazine and promethazine, and tricyclic antidepressants like amitriptyline or nortriptyline. Increased urination can occur from diuretics, can occur from caffeine, including those in energy drinks that athletes may take prior to exercise sessions, and alcohol, which shouldn't be on the training table, can also increase urine output. Increased heat generation can come from stimulant medications, such as amphetamines and methylphenidate, which might be prescribed for ADD or used as performance-enhancing drugs. Sympathomimetics like ephedrine, pseudoephedrine, phenylephrine can also increase internal heat generation, and nicotine has recently been found to also have this effect on the body. Again, these lists of diseases and medications are not complete, but just are some examples of things that need to be considered in allowing children and teens to exercise safely. Next slide, please. Pediatrics is all about prevention, and heat stress is no exception. There are steps that you can recommend to prevent heat-related illness in children at every age. Next slide, please. For children and teens involved in sports and active play, it's important to know the local heat risk and avoid strenuous play or outdoor work during the hottest time of the day, typically from noon to 4 p.m. most summer days, but during the especially hot weather from 10 a.m. to 6 p.m. We'll discuss specific heat risk tools in the next few slides. Attention to hydration is crucial for preventing heat illness. Starting practices or training sessions fully hydrated, having regular breaks for rest, cooling, and replacements of fluid lost through sweating will go a long way to keep kids and teens safer on hot summer days. Rehydrating after activity can be guided by comparing pre- and post-activity weights. Wearing lightweight and light-colored clothing made from open weave or wicking material will aid evaporation of sweat and the cooling process. You want to avoid using heavy sweat clothes that quickly become saturated with sweat, which then can't evaporate and help to cool the body. Acclimating to heat through gradually increasing duration and intensity of exercise before tryouts start, and the gradual introduction of pads and helmets during early practices will help with this process. For infants and young children, it's important to always take them out of cars, even for the briefest of errands. Temperatures inside cars can rise rapidly to dangerous levels, even on days with less intense heat. Check the surfaces of playground equipment and other surfaces for excessive heat before the kids get on them. Children who can get around independently may find a pool or beach area tempting on hot days. Make sure they don't have access to these areas and always supervise them around any body of water. And make sure the furry family members have plenty of water and a cool area to rest on hot days. Also check the surfaces that they'll be walking on to prevent burns from their paws, as asphalt surfaces can get extremely hot on very hot days. Next slide, please. Heat risk tools can help with decision-making for activity during hot weather. I included the air quality index here also in this list, which gives the local air quality by zip code for particulate matter down to 2.5 microns and for ground level ozone. Air quality is affected by heat, and the air quality index can help guide decisions and activities for kids with respiratory illnesses such as asthma. The heat index is available through the National Weather Services as www.weather.gov. The heat risk, which is a new tool from the Weather Service and the CDC, gives the heat risk by zip code and projects it for the subsequent 7 days. This is available at www.cdc.gov/heat risk. And the wet bulb globe thermometer is useful for on-site heat determination, such as at athletic practices, outdoor work sites, and for areas where military training is going on. Next slide, please. The heat index combines the air temperature measured out of direct sunlight with the relative humidity to give an apparent feels-like temperature. So if you have, using the chart, a temperature of 90 degrees across the top bar and a relative humidity of 55%, that would give you a heat index of 97, which falls in the extreme caution section. It's important to note that the heat index changes through the day as the temperature rises and falls. The color-coded areas show increasing risk for heat-related illnesses as the temperature and humidity rise. Next slide, please. The heat risk tool uses a slightly different color-coded risk scale and factors in recent weather trends in addition to temperature and humidity, and also local reports of heat-related illnesses at medical facilities to give a forecast by zip code for the heat risk over the next 7 days. Just to run through the categories briefly, the green is little or no risk from expected heat. Yellow is a minor heat risk, which can affect individuals who are extremely sensitive to heat. Orange is a moderate risk day. Those without effective cooling or adequate hydration will be at increased risk. Red days are major heat risk days. This can affect anyone without effective cooling or adequate hydration. Anyone who's involved in vigorous exercise on a hot day. And magenta is extreme heat risk for anyone in any kind of outdoor activity. This was just released a few months ago for the continental US and is still considered experimental. So they're going through beta testing right now as it becomes more widely used to see how they can improve upon this service. But it does give you a longer term view of what the heat risk will be for the upcoming week. Next slide, please. Here's a picture of a wet bulb globe thermometer, which takes 3 separate temperature readings. The black globe measures the solar temperature, the wet bulb in the center factors in humidity and airflow, and the dry bulb at the right measures the air temperature. The device will give a calculation of the wet bulb globe temperature that factors in each of these readings. A similar risk table based on color-coded risk table based on this reading will indicate the local heat risk at the site where the thermometer is being used. These will likely become more widely used for outdoor athletic events, for colleges and high schools doing summer practices, and at mill training facilities where heat risk needs to be monitored closely during the for the duration of the activity. Next slide, please. I'll conclude my talk with a big picture message here. With the election right around the corner, it's important to support candidates who will work to provide today's children a healthy and sustainable planet in which they can raise their children. Combating climate change requires state and federal policies that take steps to reduce fossil fuel dependence and use and to promote increasing use of clean energy sources. Climate health is child health, and we all need to work together to give children the healthy future they deserve. Thank you for your attention.
Thank you so much, Mike. That was, I think, as a health professional and environmental advocate, I got a lot out of that. And as a mom, I certainly got a lot out of that, to be able to have the tools and resources in our changing climate to protect our kids when we know there are more hotter days and lasting longer into the fall season. And in particular, that wet globe thermometer was interesting because at least in Maryland, and I just had a friend visit who used to live here and is now lives at farther north, said, goodness, I forgot the humidity around here. So I think that, can really help us understand not just the heat, but humidity and impacts on our health and what we can do to protect ourselves. I'm also going to put a voter engagement tool in the chat for everybody to take action on that last message you left us with. And with that, I'm going to hand it over to Elizabeth. Thanks so much.
Thank you. I'm very excited to present today on the impact of plastics on children's health. I hope that at the end of these 10 minutes that you will be able to understand why plastics have health risks, what those health risks are to children, and how to mitigate against those risks. So what are plastics? Plastics are synthetic materials made from repeating units of the same molecule. So each individual unit is called a monomer. And when the monomers are bound to each other, they form a polymer. That is why plastics generally start with the word poly, as in polyethylene or polystyrene, which you would know by its trade name of styrofoam. All plastics polymers are derived from fossil fuels. So your plastic water bottle, your polyester shirt, or your microfiber towel all came from natural gas or oil. After the fossil fuels are extracted via fracking or other methods, they are refined and processed into different components. Two of those components, naphtha and ethane, can be heated to over 1500 degrees Fahrenheit in a process called cracking to create ethylene and propylene, the most common plastic monomers. These monomers are then polymerized and further processed with various chemicals to create a final plastic product. So my colleagues here on this panel have been discussing the health impacts of global warming and climate change on children. The plastics industry is part of the climate problem. In 2015, plastics accounted for 3.7% of global emissions. And while that might not sound like a lot, And if the plastics industry were a country, it would be the 5th most polluting country in the world. Furthermore, this share of global emissions will only increase. That's because plastics production is growing exponentially, and the petrochemical industry is relying on this increased plastics production to make up for any revenue that they lose during our social transition to clean energy sources. So by 2015, if we don't make any changes to our plastics production and use, plastics will actually take up over 1/4 of our global carbon budget to keep our global temperature rise limited to 1.5 degrees Celsius. Thus, we can't really effectively mitigate against climate change without curbing plastics production. However, plastics have direct environmental and human health consequences as well. These consequences arise from 2 properties that plastics have. The first is that plastics are not biodegradable. They cannot break down into naturally reusable parts, and so they persist in our environment. And when they are exposed to physical forces like friction or water pressure or solar radiation, the plastics fragment into smaller and smaller pieces, which we call microplastics when they're less than 5 millimeters, and nanoplastics when they're less than 1 micrometer. As you can see by the comparisons here to a grain of salt, a particle of smoke, a virus, or a DNA strand, micro and nanoplastics are small enough to pass through the human body and enter our cells. The second reason that plastics can be hazardous to the environment and human health is that they contain many different chemicals. Certain chemicals are intentionally added to give plastics their intended physical properties. So for example, phthalates make plastics soft and flexible, while PFAS confer oil and water resistance. You're going to hear a lot more about these shortly. Other chemicals can be added unintentionally during the production phase. A report from earlier this year identified over 16,000 chemicals that can possibly be used in plastics. And concerningly, most, so 66%, have not been tested for safety. There's no data about their hazards. Meanwhile, 26% are known to be hazardous or toxic in some way, and another 7% are considered less hazardous. Unfortunately, there's very little oversight of the chemicals in plastics. The report found that less than 6% are regulated. So this is a problem because that there are so many potentially toxic chemicals in our plastics. And the reason is that the chemicals aren't tightly bound in the actual plastic. So going back to what we learned earlier, plastics are made from polymers, and these polymers, these fossil fuel derived polymers, form a matrix, and then the chemicals just sort of fit loosely into that matrix. So here I'm depicting the chemicals with red circles and black triangles. And because the chemicals are not tightly bound, they can easily leach out of the plastic material at any point and make their way into the environment and our bodies. So how do they actually enter children's bodies? How do the microplastics and the chemical additives enter the bodies? There are 4 main modes for children. You have inhalation, so we can actually be breathing in microplastics or chemicals from the air. We can be ingesting them. There is probably some absorption through our skin, but that's a less significant source. And then finally, I'll go into this a little bit later, there can be in utero exposure to the fetus. So plastics are basically ubiquitous in our daily products, and they're also widely present in the environment as pollution. And so they basically make their way into our air, into our food, into our drinks. I'm not going to go into detail about this since we don't have enough time, but there are lots of studies showing the extent of where micro and nanoplastics and their chemicals come from and what makes it worse. Babies do get in utero exposure via microplastics and chemicals via placental transfer. So this here is tissue samples from rat fetuses. The rat fetuses, their mothers had a large exposure to micro nanoplastics 24 hours prior to collecting the tissue sample. And all the white specks that you see in this photo are micro nanoplastics in the fetal rat liver, kidney, lung, heart, and brain. For obvious reasons, we don't have human studies of micro nanoplastics in the fetus, but we do have analysis of human placentas after delivery and of the meconium, which is the infant's first stool, and those show micro nanoplastics. We know that the chemicals can also pass through the placenta as well. So once they're in our bodies, plastics and their associated chemicals can spread throughout the body. They have been detected in most human organs, including the brain. These studies have been done in adults, but blood and stool analyses from infants and children confirm their presence in young bodies, and concerningly, sometimes at higher concentrations than in adults. So how do these polymers and chemicals impact children's health? Well, in terms of the chemical additives, many are known endocrine disruptors. This includes bisphenols like bisphenol A, BPA, phthalates, PFAS, and flame retardants like PBDE. We have decades of studies linking endocrine disrupting chemicals to negative health outcomes. And actually, the Endocrine Society of America is a big proponent of trying to control these chemicals and limit their use and impact. There are 4 areas I wanted to highlight that are relevant to children's health specifically. This includes birth outcomes, neurodevelopment, obesity, and the reproductive system. So we know that prenatal PFAS exposure is associated with lower birth weight. We also know that prenatal phthalates are associated with preterm birth. For neurodevelopment, prenatal and perinatal PBDE, the flame retardant, causes IQ loss, and we actually have very high quality studies, longitudinal studies from in utero exposure to childhood proving this. We also know that PBDE is associated with ADHD. BPA has been associated with behavioral problems in boys, and there are concerns for the links to autism, but the study results are mixed and not as high quality, so I can't say this definitively. There is a lot of research showing that PFAS and BPA are associated with obesity, diabetes, and fatty liver in both children and adults. And we have known physiological mechanisms in animal studies and in vitro studies and human clinical studies long-term with children and adults. Finally, for the reproductive system, endocrine disrupting chemicals can trigger early puberty in females and decrease sperm count in males. The direct impact of the plastic polymer itself is newer research and is more speculative. These studies are limited to analyzing human cells in test tubes or animal studies, but the preliminary evidence is concerning to me. We know that micro nanoplastics can trigger inflammation and or cell death in the tissues where they're found, especially the lung tissue and the intestines, which would be the main modes of entry into the body. In rodents, we know that micro nanoplastics can alter the gut microbiome, leading to growth of more unhealthy bacteria. And in clinical medicine, this is sort of the new forefront of medicine, the gut-brain connection and how the gut microbiome interacts with our overall immune function and our overall brain health. Finally, there are rat studies linking micro nanoplastic polymers to altered metabolism, and that these changes persist even in the offspring of the affected rats. So you may be wondering, why is this a problem now? Why are we hearing about this all of a sudden? It's really based on the sheer amount of plastics and chemicals in our world. As you can see in this graph, production has increased exponentially. Half of all plastics ever produced by humans in the world were produced in the last 20 years. And unfortunately, most plastics end up burned, dumped, or landfilled, which contributes to plastic pollution. As we learned earlier, these plastics never really go away, and so they just accumulate in our oceans, in our water sources, in our soil. Moreover, if we continue with current trends, we will triple our plastics and chemical production by 2050, which means the problem of micro nanoplastics is only going to get much, much worse if we do not take any action. Much of this projected increase is going to be in single-use plastics and packaging. So in terms of mitigating against these risks, unfortunately at this point, Micro nanoplastics are unavoidable. Nobody can ever be completely free of them, but there are actions you can do to lower your children's exposure. So for food tips, don't microwave food or drinks in plastic containers, and this includes baby bottles, baby milk. If you can't afford glass bottles, that is better. Avoid plastic single-use or reusable water bottles and use stainless steel or glass instead. Don't use microwavable popcorn bags. They contain a lot of PFAS. Filter your tap water. Avoid canned food and drinks as well. That's not a plastics problem, but it is a chemical problem. Most of those cans are lined with BPA. Finally, try to avoid nonstick cookware because it contains PFAS. Just a little more about the chemicals. So the factors that influence the migration of chemicals from containers into the food include high temperatures. So again, that's why we say don't microwave things or heat things in plastic containers. Longer contact time. So the longer food has been in contact with the plastic, the more chemicals leach, and use small portion sizes and fat-soluble chemicals. For home tips, try to avoid plastic teething toys, improve your indoor ventilation through open windows or filters, and vacuum regularly and mop. Of course, this is a systemic problem, so we need systemic solutions to help tackle widespread global pollution. You can encourage your organizations, whether they be social organizations or work, to use less plastic. You can sign up for action alerts through various nonprofits, and you can contact your legislators and ask them what they're doing to address plastic pollutions. There are lots of bills that have been introduced but haven't passed that can really make a world of difference in reducing our overall exposure. So I'll leave the summary slide for you to read. Thank you for your time and happy to take questions later.
Wonderful. Thank you so much for that presentation. I appreciate it, especially at the end. Recognizing that when it comes to climate change and the associated issues, there's always individual actions we can take to mitigate against the impacts and protect our friends and families. And we can also be a part of systemic change, that policy change, to make sure that everyone is protected, and we can also mitigate future impacts as well. So everyone tuning in has the opportunity to take action both at home and as part of systemic change. So really, thank you for that. Ending on that note and handing it over to our final presentation on climate change and children's mental health. Over to you, Bob. Oh, don't forget to unmute, please.
Can you hear me now?
Yes, we can.
Okay, great. Very glad to be here to talk about this important issue of climate change and mental health. And climate change can affect children's mental health in two ways. One is by the direct effects of global warming and climate events. And secondly, by children worrying about the future, which is a term that's been come to be called eco-anxiety. In terms of the direct effects of global warming and climate events on children's mental health, we'll look at first at the direct effects of heat and pollution. This problem actually starts in prenatally in the mother's womb. There have been a number of studies that show that women who have been exposed during pregnancy to high temperatures and air pollution have children that show slowed development, lower activity levels, lower levels of self-control, higher incidences of ADHD, and higher incidence of psychiatric disorders later in life. Children also who are exposed to high temperatures, air pollution, or drought show sleep difficulties, disrupted cognitive development, learning decrements, and increased incidence of depression and ADHD. Extreme weather events have an even greater impact on children. These are fires, hurricanes, tornadoes, or floods that children are exposed to. And children that are victims of these events show full-blown post-traumatic stress disorder in the short term. And in the longer term, years later, they have a significantly higher incidence of depression and anxiety disorders. Children that are exposed to these events have a high risk for a number of horrible outcomes, including death, parental loss, lack of housing, disrupted schooling, financial stress, lack of medical care, and malnutrition. So it's easy to see why children that are exposed to these events have poor mental health outcomes. Now, the second major way in which climate change is affecting children's mental health is eco-anxiety. This is children expressing significant worry about their future in a world of climate change. The age of onset of eco-anxiety varies tremendously, and it's related primarily to a child's level of exposure to climate information, as well as a child's ability to understand and integrate that climate information. The earliest reported age so far in the psychological literature is age 8, and the incidence goes up gradually with increased age, so that by age 16, 70% of all children are expressing significant worry about the future due to eco-anxiety. Now, for the vast majority of children, eco-anxiety is a mild increase in the child's overall level of anxiety related to a conscious awareness of a real problem. This is a normal response, and it doesn't mean that the child has a psychiatric illness. And it does not require professional psychological help, but children can benefit greatly from community, school, and parental supports. Now, as a disclaimer, children that experience eco-anxiety may also have other psychological or psychiatric problems. And if a child is showing any of the following symptoms, that means there's something other than eco-anxiety going on, and they should be directed to professional help. These would be things like a significant increase in their overall level of anxiety related to all issues, obsessive, unremitting negative thoughts about the future, change in sleep patterns, change in eating patterns and weight, frequent stomach aches or change in bowel habits, change in school performance, loss of interest in friends, depressed mood, or suicidal thoughts. If a child is demonstrating any of these symptoms, that means there's more than just eco-anxiety going on, and they should be directed to professional help. Now, the vast majority of children with eco-anxiety only need, and they will benefit greatly from, 3 things: community supports, school support, and parental support. And community supports to deal with climate change are really in the early stages of development. There are a number of public health programs in the Maryland area. The Community and Public Health Environmental Initiative, which comes out of the University of Maryland School of Nursing, is primarily active in the Baltimore area, going into the community and trying to, in a preventative way, help children with climate change issues. The Maryland Public Health Association, which is sponsoring our program today, also has a number of programs that are starting up. And the Maryland Climate Change Health Adaptation Program through the Maryland Department of Health is also another program that's early on in its development. There are a number of climate action programs for high schoolers that have been going that are very helpful for this age group. In Montgomery County, the Bethesda Green Environmental Leaders Program, and in Howard County, the Youth Climate Institute. In regard to school curricula for K through 12 grades for climate, I'm very jealous being based in New Hampshire about the program in Maryland, which is part of the Maryland State Department of Education, called Maryland Envirothon. This is a program that's already active in K through 12 public schools in Maryland, and really is an excellent model for other states to follow. There are a number of organizations that have developed school curricula for climate. These include Stanford, NASA, MIT, a group called Subject to Climate, the U.S. Environmental Protection Agency, and the Climate Psychiatry Alliance. So the curricula are out there. The problem is getting them into the schools. This has particularly been a problem in the red states, but it's a problem throughout the country right now, and we really need to work harder on getting this into the schools. What can parents do about eco-anxiety in their children? Basically two things. Provide as safe an environment as possible for their children and help support their children's mental health directly. In regard to providing a safe environment, this means picking a safe place to live. Basically, the farther north of the equator you live, the better in terms of potential climate change impacts. It's good to live in an area relatively free of hurricanes, tornadoes, fires, floods, and drought, and to live at least 20 feet above sea level. Now, this is obviously something that is going to be difficult for a lot of families to accomplish, but to whatever extent they can, it will provide a safer environment for their children. And unfortunately, people of lower socioeconomic means and people of color are going to have a harder time at this than anyone. And this is true of climate change impacts in general. They tend to affect those in the lower economic classes and people of color much more so than others. Another thing that parents can do to provide a safe environment for their children is to vote for politicians who are committed to doing something about climate change. So it's important to, check the climate programs of people that are running for office and to get out and vote. Also, reducing use of fossil fuels can help provide a better environment. This includes things I'm sure that people are familiar with, using electric vehicles, installing solar in your home, choosing green energy sources from your electric company, and reducing consumption of dairy and meat products. Now, the other thing that parents can do is support their children's mental health directly in a world of changing climate. For younger children, this involves helping children learn about climate change in a hopeful way, helping children manage their fears, nurturing children's ability to self-regulate their emotions, persist in completing tasks, having empathy for others, and being flexible and creative. And also increasing time outdoors in natural settings. This is very helpful in terms of helping children feel more positive about their environment and being able to appreciate it. For older children and adolescents, it involves things like acknowledging their worry, encouraging them to learn more about climate change, encouraging them to think of climate change as a solvable problem, which it appears like it will be as newer technologies are becoming available to deal with it. Encouraging kids to join with other young people in climate action programs. Encouraging older kids to directly address people in power and speak in public, and encouraging these older kids to increase time outdoors in natural settings like the younger kids. Again, that can be very helpful. I just want to put up some resources for kids. These are books aimed at various age levels. The Polar Bear's Home is a good introduction to climate change for younger kids. Coco's Fire is aimed at a little bit older kids in terms of presenting the issue of climate change and things that can be done about it. This book, The Story of Climate Change, is really more of a science manual that gets more into the objective aspects of climate change and things that can be done to change it. This is for ages 7 to 12 primarily. For that same age group, this is kind of a workbook for kids of activities that they can get involved in to try and fight climate change. This is for a little bit older kids and, a more science-based approach to the question of climate change. And this is a really excellent book for parents, How to Talk to Your Kids About Climate Change by Harriet Sugarman. Really wonderful book that I strongly recommend for all parents. Another good book for parents is this one, Parenting in a Changing Climate by Elizabeth Bashard. And finally, for professionals, I've whizzed through a lot of data in this talk. And this is all presented in a really excellent resource. This one here, the Mental Health and Our Changing Climate Children and Youth Report of 2023, that was done by the American Psychological Association and Eco America. This entire monograph, which is quite long and has hundreds of references about what I've been talking about, this entire monograph is available online. All you have to do is Google the title of it, Mental Health in Our Changing Climate, Children and Youth Report 2023, and it'll take you right to the entire document, which is a wonderful source for this topic. Well, thank you very much.
Wonderful. Thanks so much, Bob. I, just put a link in the chat for the last report that you shared so people have access to it. I also, remember when I was a kid, my grandmother took me to the polls to vote with her. And it was back when there were clicks and levers on the polling machines. They weren't electronic yet. And she made all her choices, and then I got to pull the big red lever, and I have a vivid memory of that. And I was introduced from a very early age how important voting is, and that you can really be part of that change. And I know one of the solutions to addressing the mental health impacts of climate change on children and youth is to make sure they know they can be part of the solution, and inviting you to be part of the solution. And so I think that, wanting to end on a call to action, I just really appreciate sort of each of you doing that, and reminding people to be part of the solution, and making sure that recommendations that come from youth really are reflected in policy solutions and pathways to policy change. So really appreciate the presentations today and all of the information shared and the calls to action. So I don't see questions yet in the chat or the Q&A, which I am quite surprised, but it gives me the opportunity to ask my questions, which are, I think, continuing on the theme of being part of the solution. You guys all presented a lot of information that could be overwhelming. It's a lot of information. There's a lot of different ways climate change is affecting us. So how do you put that into motion? How do you stay motivated to work on this? Because it can be pretty heavy stuff. So what are one or two things that you do to keep going, to stay motivated? Because I have to say, I still have a few decades left of work. And so I need to also stay motivated and in this. So how do you stay motivated? How do you stay optimistic is a strong word, but how do you stay hopeful, optimistic, motivated, whatever direction you want to take with that word?
Well, I can take that one first. One thing I do is have frequent contact with my grandson, who convinces me that we can't give up on this because it's going to be his world, and we're responsible for the mess that it's in right now, and we've got to keep working on trying to fix it. The other thing I do is to keep up on technical advances in the climate change world, which are happening every day, and make things more optimistic. There have been incredible strides in terms of battery storage technology, which will enable wind and solar to be more effective means of providing, the power that the world needs. There are other, technologies being developed to try and figure out how to carbon capture and reduce our CO2 levels. And these are bearing some fruit. So that's one of the things that keeps me inspired in a positive direction.
Awesome. Mike?
Yeah, I think for me, when I was younger, I could see that the world was getting somewhat better year by year. I mean, there were stresses and wars and other types of things going on that were concerned, but you work past it and the world seemed to be improving. But over the last 30 years, 20 years, you can see climate change being one of the biggest factors that we're leaving our kids a world that's much less optimistic than it was when I was a kid. And I think being a child, they shouldn't have to have the worries that they have right now, and that what it takes is a lot of will to make difficult choices, to make the changes that need to be made to give kids a healthier world to live in and to grow in so that their kids could have a sustainable world for themselves. And that's my main motivation, is to try to create a place that kids can be happy living in, and to get rid of some of the worries that they have. There's a lot of negativity in the world. Politics has made things worse and not better. It's stopped becoming a tool for solutions. So, talking as much as possible to get the message out that things can be better, and that there's work that we all can do to make things better. That's where my motivation comes from.
Sure.
Yeah, Elizabeth.
Yeah, so as a psychiatrist, I'm acutely aware that a lot of this can be extremely overwhelming or make people feel hopeless or stuck or demoralized. And we know that those emotions can really be counterproductive because they keep people feeling sort of helpless and like there's nothing to do. And I don't want people coming away from this talk feeling that way. So we as humans have a lot of ingenuity, a lot of creativity. We developed to be social creatures and work together, and we've solved big problems before. We've had the problem of lead. We learned that lead causes severe intellectual disabilities and other developmental problems in children. We got rid of lead in paint, in gasoline. We were on top of that. We had the ozone hole growing, and we sort of stopped the aerosols, and we helped sort of mitigate that problem. So we have ways that we've been able to accomplish big challenges before, or attack big challenges before. So I think with enough education and action, we can do the same thing. Another thing that keeps me going is a little bit of anger. So learning about a lot of these companies that have known from the 70s that fossil fuels will cause irreparable damage to our planet and humanity. They have reports from the 70s from their internal documents. That's part of the basis for lawsuits that are pending against these fossil fuel companies. So that anger is a very motivating force. And finally, as you said, there's so many ways to take action. So I'm going to put a link to this Venn diagram that climate activists and scientists created, and it's basically thinking about what is important and necessary. And there's so many things that are necessary right now. So you can basically pick anything. What brings you joy? For me, it's talking about sustainability and how to change things in our lives to be less harmful to ourselves and to our planet. And what are you good at? So I'm trained as a doctor, so I'm using that expertise to talk about it. So that's how I came to this platform, but everyone has their own set of things that bring them joy and things that they're good at. So choose what you want and go for it. There's so many ways that you can help be part of the solution.
Yeah, that same the person who put together the climate, the diagram you just mentioned, which I think is an excellent reference, Elizabeth Johnson, just came out with a book, What If We Get It Right? Yes. So it's a more optimistic take on climate solutions. It's what if we get it right? And that's a nice thought. There's one question in the chat, if you can answer quickly, Elizabeth, about recycled plastics. So it is true, we see a lot of materials, building materials, clothing materials, bags, that say, I'm made from old water bottles. What's the sustainability, or really what's the toxic implications of those materials and recycling the plastics?
Yeah, so the problem with plastics is they're not great for recycling. So even if you recycle them once or twice, they degrade over time. So you can't perpetually recycle them. You're still going to need new plastics. And even most recycled products are majority, if not nearly all, virgin plastics, which we mean newly extracted fossil fuels. It is good to try to keep them out of it's not good to burn them because you're releasing that in the air and causing air pollution. It's not good to have them be litter in the environment where they break down. It is better to contain them, but again, if you're having that in your home, I'd be worried how much is being emitted. So you still have those concerns. I don't have the studies on those newer there's sort of new things that have been created. So I don't have studies about exactly how much is being emitted. But we do know, like, for example, plastic flooring and plastic furniture does emit that. So I would still be concerned about having a home made entirely out of plastic. Again, we can't get rid of all plastics, but we can we didn't have them 40 years ago, right? We can still survive and do medical care and do many things without, having a lot of these unnecessary plastics. So the goal is really to reduce unnecessary plastics.
and which reduces our reliance on fossil fuels. So thanks so much, Elizabeth. Thanks to all of our speakers, and the Maryland Public Health Association and Melanie for hosting this webinar, for being part of this webinar. Thanks to all of you for being active participants. And we invite you to be part of the solution and join Maryland Health Professionals for a Healthy Climate. I put a Google form in the chat so you can sign up with us if you're not already a member. And don't forget to vote. You can use the Maryland League of Conservation Voters voter outreach tool to not only check your registration, but make a plan to vote. I made my plan. I have my mail-in ballot on my kitchen table, and I made a plan. I picked the box I'm gonna drop it off at, and I picked a date and a time. And then I checked the box and said, yes, please send me a text message and remind me to do so. So I picked my date and time. I know when I'm gonna drop off my ballot, and I have my plan to vote. And I encourage all of you to do the same and call 5 friends while you're at it. So thank you so much again, and we'll catch you another day. Thanks so much. Happy Children's Environmental Health Day.